there's that first 6 to 12 hours with the PCA pump. Most folks, and I would say now, I think I've had either 2 or 3 patients since the year 2000 that haven't gone home the next morning. So sometimes, it can be worse, but not very often. In hundreds of embolizations, most folks go home the next morning. We send you home with a non-steroidal drug, which is a Motrin or Aleve type drug, ibuprofen or naproxen. That is the most important part of the post-procedure management because it's very good at dealing with the crampy type pain that women will have. We send you home with a drug to help with the nausea. We send patients home on a stool softener because we want to keep the stool soft so that they're not straining against their groin puncture. And finally, we send the patients home with some narcotic, which is, we send them home with 30 pills. And again, very few patients ever need more than that. I tell patients the typical course is if you have this procedure done on a Thursday, you go home Friday. You're a little bit under the weather on Saturday and Sunday. You'll be off the narcotic drug by Sunday. Average number of pills taken in a study by a guy who does this full-time on the East Coast is about 10 narcotic pills, which is not too many over the first week. You'll get better and better and better, and by a week out, most women will be back at their baseline. If you push the envelope a little and you take women who are a little slower to recover, you're talking 10 to 14 days. I maintain that the women who get better at 3 days to 7 days are the women who would recover from a hysterectomy in 3 to 4 weeks, whereas the ones who take 2 to 3 weeks from my procedure are the ones that might take 6 weeks to a couple of months to recover from a hysterectomy. There's actually no question that the time to recovery UFE is much less invasive than a surgery. The time to recovery has been, in the medical literature, proven to be far less.